So welcome to another episode of Dr. Dallas Unleashed. Anjelica is here with me today.
In the building.
And this is going to be a hard-hitting, fast, packed with a lot of good info for our patients. So it's not going to be one of our longer episodes. It's going to be just short to the point. So this title is going to be about you've decided to have surgery. What do you do now? How do you get prepared for having a surgery? And I think, that's just a common question for everybody. Right. You've had surgery before. Yeah. Why don't you tell the audience, before I kind of get into some of the things that I would want from a surgeon's perspective, what did you do to get ready for your surgery?
So I had to make arrangements to, take off from here and have somebody come take care of me. So my mom had to fly in from out of town and take off whatever she was doing and make sure that she had time to take care of me.
That's super important too. Yeah. That's like the logistical part people don't think about. They're thinking about, I might have to get my labs, I have to get medical clearance, but that's a really important thing to have somebody take care of you or be with you just so, you had a breast augmentation and you don't want to pick up anything heavy. You might need that help that first day. Mm-hmm. You have a load of laundry to do. You can't do that, after that sort of thing. So absolutely making sure that person's available.
Right.
Yeah.
And then, like you said, labs, getting your blood work in to make sure you can actually qualify and get surgery, make sure everything's tested good. And so I had to do that. I had to kind of rearrange my schedule as well.
Right.
And then just start planning for how many weeks I would be out when I can start doing things again.
Right.
And kind of go from there. I mean, and wait for these magic results to kick in,
Exactly. And they happen right away.
Yeah, they're instant. But they are literally instant.
The swelling, all that stuff will get better. But let's just take it from the top, from how I think about it, what a patient should think about. Right. You've decided to have surgery. Now what? So let's kind of envision ourselves. We're 3 months. We've made that decision. Surgery's coming up in 3 months. One is for everybody to have surgery here. We want a BMI less than 30.
Yes.
So you've already got the surgery planned out. We don't want you, if you're on the cusp of being, a BMI of 30 or over 30, we don't want to see you gaining weight. So you start, jumping into that 31 category. So BMI is your body mass index. Really easy to do. We tell patients all the time, go to Google, go to BMI calculator, and that's going to be your weight in kilograms or pounds over your height squared. Mm-hmm. So let's say, example, you're 5'5" and you're 170 pounds. What BMI do you think you are?
This is
Just take a wild guess.
I'm going to go with like a 28.
Yeah, very close, 29.
Oh, it's close.
Yeah.
There you go.
So someone who's 5'5", let's say a female who's 170 pounds, that they probably could lose some weight.
Yes.
But they qualify for surgery here. We just don't want to see that going up. So that takes us to our next point. 3 months ahead of time, start eating healthy if you don't already eat healthy. And I would like to think a lot of our patients, like you, already work out, eat healthy, but there are a lot of bad habits people do that they might not even know are really bad. I think one is, and this is the easiest way to lose weight. If you're a soda drinker, 3 months before, cut out soda.
100%. Right? Switch to a soda water, like a LaCroix or like a bubbly or something that it's not going to have any sugar in it. It still gives you that carbonated.
Yeah, exactly.
So
if you like easier. That carbonation.
Soda water. Chico.
If you guys are watching YouTube, you want to see less of this and more of this.
More of this.
No, yes. And, and so it's really interesting when I ask people like, hey, because they'll say like, it's hard to lose weight. How do they lose weight? And then I just ask them for their general diet and they'll say, well, I try to eat like a Subway sandwich and I'll have a Diet Coke for, lunch. And for dinner, maybe I'll do an Arby's or Chick-fil-A and I'm being healthy because I'm having
chicken or something
with a Diet Dr. Pepper.
Right.
It's like, no, just cut out. Even the diet's got really not so great stuff in it.
It's like
all the replacement sugars are just as bad as having sugar.
Right.
And nowadays people are thinking you might as well just have the sugar than having a lot of these like NutraSweets and all that sort of stuff.
Yeah.
So if you can cut out the sugary soda drinks already, you're going to do much better. You'll see that weight start to slip off.
Right.
The other thing is just eating healthy. I think there's a confusion with, I'm going to have a Chick-fil-A chicken as opposed to a Whataburger or McDonald's cheeseburger. Well, they actually have very similar calories. Right. So eating chicken or a fish sandwich at McDonald's is not really that much better. So I think like you and I, we are vegetarians essentially. Yes. And so, there's not a lot of options at fast food restaurants. So we're forced to do the salads and that sort of thing. 3 months before surgery, start doing that. I think it's just stay away from the drive-thrus, fast food as best as possible, but also try to incorporate, I think, vegetables.
Yes, lots of veggies.
The American Heart Association recommends, or I think it's the American Diabetic Association recommends like 12 servings of vegetables, which seems great. Like a lot, but you can get those in 3 meals. Yes. By having a good cup worth of vegetables. But that's the hard thing about eating healthy is because it's expensive and it's hard. But I think people can do this for 3 months before surgery.
Yeah, and then it becomes a habit or a lifestyle. Right. And you're always changing to be better and better yourself. I think a lot of people will get right underneath that 30 BMI, and then they're coming in here sometimes for the wrong reason and thinking that this surgery is going to be a big weight loss transformation for them, and they're not taking the steps to prepare themselves for surgery. Like you said, like eating healthy, and they're continuing to eat unhealthy and all these bad trends, and liposuction will take care of it, or his tummy tuck, but it's not always that outcome.
Yeah, a little thing for people. The last thing I want to hear when I talk to a patient and I ask them, how's your weight been? And they go, well, right now it's the heaviest I've ever been. So that's why I've come in. And I'm thinking in my head, no, it really should be a time where you've lost a lot of weight and now you have a lot of loose skin. Or I can't just, I've been working out really well, but I can't get rid of this little extra skin. Right. Because when I hear that the heaviest and somehow like, oh, I can't do it anymore, you're my last resort. Really, we're not a weight loss procedure. Yes, plastic surgery is about body contouring. So that's where diet really comes in handy. So we talked about cutting out the sodas, eating healthy, staying away from fast food. Right. What other advice can we give about eating healthy for patients?
So like we said, is incorporate a lot of veggies. I think a nice protein is good. So maybe not such heavy red meats. And if you're going to do a big juicy steak, limit it to once or twice a week, if anything, and start incorporating like lean chicken or lean turkey or a piece of fish, and try and stay away from frying it, rather baking or boiling something along the lines of that. And adding fresh fish or even like shrimp to a salad always helps too. So proteins will help keep you full. Yeah, and I think the right type of proteins, because you're right. I think fresh fish, and they always say these organic or wild caught fish that aren't like done in these nurseries where they're feeding all that stuff to them. Salmon is always really good because those type of proteins are really healthy. When you start getting into the meats, especially processed meats, it's hard to tell, these, are they organic? Are they grass fed? But, steak in general or meat like that is very pro-inflammatory. Even if it's from a wild caught, cow or, grass-fed cow, it's very pro-inflammatory. Yep. And so I think that's what we see as being vegetarians. We don't have a lot of those issues when it comes to the things in our bodies that are causing a lot of inflammation. This will manifest like in sometimes headaches, digestive problems, just overall sense of, well-being and energy. I agree. I feel a lot better when we're not eating a lot of steak. If meat is a staple food every single evening, like a heavy steak, that's way too much. It should be like a fresh fish a few times a week. Yes. And that's about it. So I think people 3 months before would really do themselves justice, not becoming a vegetarian, but I think staying away from those heavy meats, steaks, those sorts of things. It's really hard on your digestive system and pro-inflammatory. So ultimately, you want to create an environment for the body to heal really well and really quickly and not have a lot of these things going on in your body. So I like that. So the way you eat. The other thing I wanted to touch on was, and I've been doing this recently, and I think a really easy way to maybe kind of drop a little bit of weight is intermittent fasting. Yes. And I think people talk about it, and there's different confusion about, do I just go on like water for 3 days? No. And there's a lot of different ways to do it. There are some fasts where they ask you to do that, just water for a couple days. These pseudo fasting things where you have like certain beef broth
or broths that sort of sustain you for 3 days. No, what I'm talking about is something that the everyday person can do, like me, and that's called intermittent fasting. So what does that mean? You don't want to eat for like a 12-hour period and then save your feeding for a very, maybe 6-hour period in the day. Yes. So how does that work? I try to eat dinner between 6 and 7 o'clock in the evening.
Okay.
Whatever I eat will be my last, thing to eat. Let's say it's 7 o'clock. And then I won't eat anything until the next day at lunch. So I'm skipping breakfast, and my next meal is at noon or 1 o'clock. So during that time, your body is basically kind of tricked into like this starvation mode.
Yes.
And it starts mobilizing a lot of your fats from your adipose tissue, which is basically your fatty pockets. You can think about your tummy, your flanks, whatever. It's mobilizing that fat and also mobilizing the fat in your liver, which all contributes to weight loss.
Yeah.
Because if let's say you had a sandwich or something, and then you went to go work out. Well, your body's going to be really working on trying to digest and how to deal with those calories that you just ate.
Yeah.
If you don't have anything in your stomach to digest, it starts mobilizing all the fat in different places.
Exactly.
And it doesn't mean you have to work out in the morning. Just the fact that you're up, you're walking around, doing those things, your body is going to start mobilizing the right fats. So intermittent fasting, I think, is really helpful.
Yeah.
Have you had any experience with that?
So I have tried to do the intermittent fasting before. I think it works really well. And I know that maybe somebody is not used to starting off with 6 hours. And especially if you're somebody who eats quite a few times a day, you like to snack throughout the day, I would start off with like 4 hours, start small and then eventually work up to that 6 to 8 to 10 hour period that you can cut yourself off from eating. Another thing that a lot of people don't realize is coffee in the morning. Yeah. They add all the sugary drinks. You'll go to your Starbucks, your Dunkin' Donuts, and you'll get something that is not healthy. And recently I've been switching over to black coffee. I've been trying to do it.
Like me.
Yes.
Was that me who showed you how to?
I just realized, no. I don't think it was you, but I mean, I'm going to take tips from it, but I think that it helps get, things moving in my stomach a little bit more rather than I can feel like I almost like crash because I was putting like Splenda and cream. And, I already have like some sort of like dairy allergy.
Right.
So it bothers my stomach. So I tried to take that out just to be more comfortable at work. And, and I'll still drink my coffee. And with intermittent fasting, I think you're able to drink black coffee.
Yeah, it's considered, if you don't put anything in it, black coffee will not break your fast. Yeah. So you're still considered fasting if you have a cup of coffee.
Right. And you'll still get that caffeine. Yeah. And I know for me, like if I want to go for a snack, I know a lot of people will reach for a bag of chips or something that's unhealthy or a piece of candy.
Right.
Really, I think it's important to do a handful of nuts, an apple, and some nut butter, some sort of almond butter, cashew butter, even peanut butter if you do the lower sugar ones. But little small changes here and there, I think will help them a lot.
So once you're in that feeding window, when you're intermittent fasting, right? This is not during the fasting portion, but when you start eating, let's say it's noon to 6 o'clock at night. If you're feeling like a snack in between your lunch and dinner, nuts are a great way because they have fats in them.
Yes.
And the good kind of fats. I mean, as long as you're not chowing down like, a whole bag, you're going to feel a little bit more full because fat is what makes you feel full.
Yes.
If you were just to have like carrots and that sort of thing, and I've done it before, you have carrots and it tastes pretty good. It doesn't make you feel full. Mm-hmm. So you might need those carrots and some pecans or almonds or whatever it might be.
You do that with your salads too. You don't just leave it just plain lettuce and a little bit of lemon juice. You add the craisins, you add the walnuts, you add the almonds and carrots and all different types of things to get the fats to make sure you're full throughout the day.
Right. And that's exactly what Anjelica was saying. I always have a salad for lunch, and I'll put in just normal lettuce that you get there at the store. I don't use any type of dressing other than I'll put olive oil and virgin olive oil, and then a little bit of vinegar. What's the one that we use? Vinegar? Balsamic. And then I'll put a little dash of apple cider vinegar, which is good for your digestive system. And then I'll put the nuts. I'll put raisins, nuts, which is usually almonds and pecans, blueberries. I'm trying to do things that I've read that are very anti-inflammatory or good antioxidants. So their job is to help with all the inflammatory stuff going in our body and actually suppress it and make it better. So I don't have arthritis, but if someone had arthritis, these are things that would really help them, right? Yeah. Less of the meats, more blueberries, nuts, because those sorts of inflammatory states like rheumatoid arthritis can really get worse if you don't eat right.
Right.
One thing about the coffee is just be careful when you're fasting and then you have coffee. They call this the caffeine. If you have it like a naked caffeine effect, meaning there's nothing in your system, you're going to feel like caffeine hit really hard.
Yes, exactly.
And sometimes people can get this like jittery sensation afterwards. I get that sometimes too. So I don't pick a strong coffee and I drink it really slowly. And if it's just too much, then perhaps putting some medium, what is it called? Medium acid triglycerides, MCT oil.
Yep.
So basically that is some sort of fatty portion that you would put in your coffee. So it will give you a more sustained caffeine rather than this high spike and down. Again, that would break your fast, but it's very little. And if that seems to give you a better caffeine, certainly do that. You know, you're not going to be gaining, pounds just because you have a little MCT oil in your coffee. Right. I don't do it. I just drink the coffee slowly. But people do talk about just having caffeine on an empty stomach and you've been fasting. All right. So enough about diet. Nutrition. I think people, understand that nutrition's important.
Very important.
What about sleep? I think sleep is super important.
Oh, yeah.
And this is actually more evident when we have patients who have surgery and they're not sleeping good for whatever reason. They all say the same thing. It really hurts. I have a lot more pain. And then once they start falling asleep and having 8 hours, they feel really good.
Yeah.
So, not only is sleep good for pain control, but it's going to just help you overall to recuperate from a surgery much faster.
And you recommend 8 hours a night, 7-8 hours?
I think that's the traditional, 8 hours. And I would say that's probably average. Some people work a little bit shorter, they just can do with less, but some people have to have more, but average is about 8 hours. So, we're talking about what do you do before surgery? If you could start getting yourself on a good sleep cycle, it's going to make your body overall just work better. You want to be the kind of harness the potential of your healing capacity. And that's going to help not only with, good diet, but sleeping well, right? You want to be the best version of yourself, not strung out on coffee, sleeping 2 hours. Mm-hmm. I promise you'll have a longer recovery if you don't sleep very good.
You don't want to feel terrible coming into surgery. You want to be at your healthy everyday point.
You can't be at your worst and expecting surgery. You already need to be, to me, the body is like a machine and you got to put the right oil in it. You got to treat it well.
Right.
Or, it's just, it's like trying to do this really cool upgrade, but the car itself is like a Pinto or like a Volkswagen Bug and trying to put like a Ferrari engine. You already got to, have those other things in place and then we're going to add to it. I think an easy one is a multivitamin tablet. Most young people aren't going to have any vitamin deficiencies, but in the multivitamin tablet, you're going to have your vitamin D, your iron in there, which is going to help for your blood stores. So anytime we do surgery, we do have some blood loss. We don't want you to be where you're kind of marginal. We want to have good blood stores, so it's not a big deal when we lose a little bit of blood. So starting that 3 months before is really helpful. If you're smoking, no brainer, right? Stop.
Yes, no, you got to stop smoking.
But the side note to that is if you vape, no vaping. That's got to stop.
What about weed?
Weed, you can't do that. Even though it doesn't have nicotine, it's still the smoke from it impairs your ability to heal in the oxygenation to your peripheral system. So yes, that even has to stop 6 weeks before and 6 weeks afterwards. Nicotine patches, same thing. Nicotine patches, the nicotine is still works with blood vessels in a way and can cause some healing disruption if you're actively on a nicotine patch and trying to heal from a surgery.
And no CBD or anything like that, or what are your thoughts?
I think that's pretty controversial. Okay. I have had people who are on CBD, whether it's patches, oils, drops underneath their tongue. Right. Okay. And for the most part, we tell people, if you're on it before, go ahead and just continue what you're doing, as long as it's not excessive amounts, and it should be fine. Because we don't want people to get off of it real quick and they get this rebound, they have a lot of pain or issues if it's really helping something. So right now the position is if they're on sort of a modest amount, just to continue it.
What about if somebody, I was going to ask something, I just kind of lost it.
Well, think about it while we're talking. Maybe have a Snickers. Only you can yourself. Have. But you started touching on some really important points, like logistically, right? What do you need to do besides the health, the vitamins, the sleeping? What about your family, right? Your mom doesn't live here in town. You're not married, so it's not like you have a significant other in-house with you, but you need to get those arrangements done soon, meaning that if you live with your husband or wife, whatever it might be, that they're going to be available to help you out. One, take you to surgery, bring you home from surgery, but also be available probably, I would say, for the first 2 days.
Right.
Just at all times to make sure you don't need anything. Everything from going to the bathroom, showering, just for that first couple days. Afterwards, should be all right. But you don't want to be by yourself where your husband just drops you off and then that's it. I'm off to work day one.
It's tough. And whoever is your caregiver, I would say, or your significant other, your spouse, you want to make sure you're on the same page. Like you both are in the surgery together.
Right.
They know what they're getting themselves into. They know that, you're going to need that help for the next couple weeks, and that, you need that support behind you. Yeah. You don't want to be like arguing on why you're doing it, and they should be there. I know for me, I needed it.
Yeah.
I needed that support.
Right. I mean, your mom was there to help you out.
She was awesome.
But I think you were kind of, the other point was, if your husband, let's say a woman comes in, a tummy tuck, breast lift, something like that, and your husband doesn't want you to get surgery and you're just dragging him in this whole mess, and you're going to get it no matter what he says, that is not a good situation to have. You're going into surgery. Your husband doesn't understand why you're doing it. So when there's conflicting motives there, I always like to tell people, don't do the surgery. Don't do it until your support system is supportive.
Yes, exactly.
Now, who cares if your mother-in-law, who might be judgy about why you're doing this, or your friend says you're just being vain, they're not going to be in the throes of recovery with you. It's your husband or whoever is going to be helping you, that they're supportive and not going to belittle you, because the favorite thing they love to do is like, oh, see, you're in all this pain. I told you. And you don't want to hear that when you're struggling, hurting, and there are times where it might be bothersome more than others, and you need someone who's going to be there, supportive, kind, and not making you feel guilty about it. You got to get time off of work.
Yes.
Right?
Yep.
You got to make sure you can't call work up 2 days before surgery and say, I'm going to need the next week off.
Right.
Let them know 3 months in advance, 2 months in advance. Don't wait too long to do that.
As soon as you book that surgery, I'd let them know, like, hey, depending on whatever you get done, I'm going to need 2 weeks off. I'm going to need 3 days off. I'm going to need this and this. And I mean, you don't have to go in detail what you're doing, but at least give them an idea of no heavy lifting for 6 weeks or whatever it is, so they can move you around.
Babysitter. You got little kids running around. You're doing a tummy tuck and you have a 2-year-old who's still used to being picked up. Make sure you have someone who can be with you. Babysitter, husband that's going to be with you. You will not be able to pick up a small child for, I'd really say, about a week, depending on how heavy they are. But just know that you're going to need help, whether it's somebody who's, your mother, your in-law, your husband. But if you have kids, make arrangements to have help for at least a week. That's really important. Agreed. We talked about people being on the same page, right? You can't do surgery. So, and then of course there's the simple logistical stuff of labs and making sure those look normal. If you're doing all the things that we suggest, I'm pretty sure your labs are going to look good. We specifically look for your hemoglobin or your blood levels. So you get that a few weeks before. I'm going to be looking at your ability to clot, so I know that if I make an incision on you, you're not going to bleed. Your body can appropriately make a clot, and that's part of blood work. And of course, you have other medical issues, medications. We want your medical doctor to give us the okay to do that. You think of anything else that would be really important that you went through or had to do before surgery that we didn't go over today?
When it comes to the pain medication, my mom did something really awesome, and she made a spreadsheet on what she gave me, when she gave it to me, and what it was for. And we documented that. I think sometimes that's a really important thing. That way you know that you're not taking two of the same thing, or you're overdoing one thing or anything like that. So I just think preparing for it.
Yeah.
Knowing exactly what you need to do.
The person helping you, writing stuff down, like the medication, super important because you're taking, let's say, Norco and a Valium. You might forget, like, did I take that 2 hours ago?
Yeah.
3 hours ago? I'm supposed to take it every 4 hours, one pill every 4 to 6. It can get confusing.
Right.
And you yourself might not be having a great memory with these sorts of things.
Yeah.
So having someone do that just takes the load of just having to really mentally focus in on that stuff when you just want to relax. So yeah, that's a great point to keep track of medications like that.
And I know that we said, I know anesthesia will say like, you're not allowed to eat or drink anything 12 hours before your surgery. And so you're not going to go out, let's say within the week of you getting your surgery and get hammered or anything like that. Or, I don't know, along the lines of, doing something to mess up your surgery.
Yeah.
What else did I? Oh, and sleeping. So, I only got a breast augmentation, but there are other patients that come in and they get a BBL and a breast augmentation. And, how am I going to sleep? What am I going to do?
Yeah.
So you have to be ready for things like that too. And, you can't sit up and, I don't know.
You can't be if you're a stomach sleeper, right? We hear that a lot. I can only sleep on my stomach. And then we tell people, well, you can't sleep on your stomach. We did a breast implant.
Right.
It can really mess up their sleep rhythms. And so, I don't know a good answer for that. You could try maybe not sleeping on your, sleeping on your back beforehand to kind of train yourself. But that is a hard one if you have a particular way you sleep. But anyways, I wanted this to be short, concise. I think we kind of hit on a lot of important points, and hopefully you guys can listen to this because we really want it to be like, hey, you decided you've had surgery. Whether it's here, somewhere else, you're in a different country, you can listen to this and really get what you need to know to prepare for any type of surgery.
Right.
And do really well and recuperate really well and have the best results your body can possibly do. So, well, thanks again. Your insight on your surgery is always great because some things that you've done I didn't even think about. Yeah. But I try to use my experience from hearing people, and hopefully this is helpful to you guys. So that's our hard-hitting topic, what to do before surgery.
Oh, yeah. You can actually find my surgery vlog on YouTube. If you go to Dr. Dallas's YouTube page and you want to watch before, during, and after surgery, what it was like, head on over there. I have boobs.
Do it. All right. So thank you for joining us for another episode of Dr. Dallas Unleashed. Until next time, we'll see you guys.
Woo!
Thanks.
See you later.
Bye-bye.